Health assessment. Assessing mouth, throat, nose, and sinuses. Equipments and materials needed. Gloves. Pen light. Otoscope. Gauze pad. Tongue depressor. Nasal speculum.
Come in. Wash my hands. Hello, Miss Alikina. My name is Nicole and I am your nurse for today. Is it okay if I will be going to have an assessment in your mouth, throat, nose, and sinuses?
Sure.
Okay, but before that, let me ask you a question. Did you smoke?
No.
Did you drink a lot of quantities of coffee?
Sometimes.
So, okay. First, we will inspect the lips. Okay. Your lips is pinkish. Next, we will inspect the teeth. Let me see. Can you please open your mouth? Okay. It has 32 teeth and the central incisor is 6 to 7 in your upper jaw was broken and have the cavities, and also your second molar 10 to 12 and 23 to 31 in the lower jaw has a cavity and there are no missing teeth, and also your gums are pink and I don't see any lesions. Next is we will inspect the Stenson duct. Can you please open your mouth? Next is your Stenson duct has no redness or pain. Next is we will palpate the tongue. Can you please stick out your tongue? Okay, so your tongue is ventral surface, smooth, shiny, and also it is pink. Next is we will inspect the Wharton's duct. Can you please lift up your tongue? So, okay, your frenulum is in the midline and I don't see any lesions or ulcer. Next we will check the strength of the tongue. I will press it here and then uh, your tongue will press it in your cheek. Okay, on the other side. Okay, and then next is we will inspect the ability to taste. I have here a small amount of salt and a small amount of sugar. So can you please taste it? Okay, did you taste it?
Yes.
What is?
Yes.
Okay, so your tongue has a strong resistance, and I feel it, and it can determine it. Your tongue also determine the sweet and the salty. Next is we will note the odor. Can you please open your mouth? Okay, it has a foul odor noted. Next is we will assess the uvula. Can you please open wide your mouth? Okay, your uvula is it? Can you please widen your mouth? Okay, your uvula is in the middle, in the midline, and it hangs freely. Next is we will inspect the tonsils. Can you please open your mouth? Okay, your tonsils are present and it is also pink in color. Next is we will inspect the posterior pharyngeal wall. Please open your mouth. Okay, your throat is in pink in color with no lesions noted. Next is we will inspect and palpate the nose. Okay. Your nose is the same as the color of your face. Next is we will check the patency of air through the nostrils of the patient. I will. Can you please sniff each of your nostrils? Okay. You are able to sniff each nostrils, and then while the other is osculated. Next is we will inspect the internal nose. Can you see your nose? Okay, your nasal mucosa is dark pink and moist, and also the superior tribunate is not visible, and your deviated septum appears in the overgrowth tissue. Next is we'll palpate the sinuses. Okay. Your frontal and maxillary sinuses are non-tender to palpation and no crepitus found. So that is the assessing of mouth, throat, nose, and sinuses. And thank you for watching.